This is the impulse machine. It works with inertial energy to allow patients to quickly regain their range of motion without operating under the influence of gravity. It's a low-maintenance machine that can help develop power, balance, and coordination. The impulse machine could have been used for over 28 years in a variety of settings such as professional sports teams and in your average clinic. Over 25 years of research have proven that the impulse machine has positive effects in the long-term rehab process. It is also used to reduce pain while teaching the body to accelerate safely. The pain reduction comes from the gait control theory. It also stimulates natural joint stabilization through the use of muscle synergy and coactivation, as well as providing smooth joint mobilizations. The impulse machine can function in all three planes of motion while removing gravity from the equation. This allows the muscle to more quickly learn to function and deal with acceleration. As weight is removed from the sled, the motion becomes more challenging as the capacity to accelerate increases. If the user does not have the coordination needed to move the sled, it won't move. By gradually reducing weight, high levels of coordination can be attained. Finally, there are several handle attachments to make the impulse machine capable of being very sport specific. Patients are able to mimic exact movements that they might perform in their sport, allowing them not only to have more efficient rehab, but more confident upon their return to play.
Okay, so the impulse machine has so many benefits to the rehab process, and I'm just going to take some time to explain a few of them. One benefit is that it increases weight and tension in exercise to increase muscle strength and performance like any other typical exercise, but it also reduces weight and exercise to increase muscle power and performance, which is more of a training exercise. It also helps with increasing the neuromuscular systems to give them a higher muscle contraction, coordination, and reaction, and because of the machine does not have gravity as a factor, it helps contractions to become more quick since there is no gravity to help the muscle. Also, the impulse machine is great with increasing coordination, and that's done by removing weight. When you use the impulse machine to increase coordination, it helps coordination rates to go up because it helps the body to have a higher learning rate, and by increasing the coordination, it will help the patient or athlete in their performance and activities of daily living, which in turn helps to reduce injury rates. And another perk of the impulse machine is that it stimulates natural joint stability with muscle synergy and coactivation with providing smooth joint mobilization. And finally, the impulse machine does a great job at addressing the entire kinetic chain during the rehab process. So the next thing I'm going to tell you about is all the strengths of the impulse machine. This machine has so many accessories that can help a patient in their rehab journey. There are lots of attachments that can be bought for sport-specific activities. So for example, we have a bat, a baseball, and we also have some other attachments. We have this handle, and then we have a strap. And these all help with different things. And you can add and take off them by just doing this little thing. And then you attach whatever you're wanting to use to the machine. They're slippery. Like so. And then the athlete can use whichever one. The machine also helps with a quick gain in range of motion and helps to teach the lower extremities and core how to support the motions of the upper extremity and vice versa. The last thing I'll talk to you about is how much does this machine cost? Usually it costs $3,600, but right now there's a 40% off discount, so you could get it for a mere $2,160. But that's for just the machine. Each attachment ranges in price from $32 to $107, depending on what you're wanting to rehab and how much money you're willing to invest.
The Impulse is a large piece of equipment, as you can see. It takes up about 32 square feet of space. It is 96 inches by 46 inches and should have room on either side to be able to do exercises. The sled, as you can see, is attached to the rope here, so that when you adjust for exercises, it will move. So all you have to do is push the sled and pull. So the slide can move back and forth up to 68 inches, but works the best over just a range of 32 inches. The Impulse machine has a frame that is adjustable. You can adjust it up to 39 inches. You can just pull and adjust. The warranty of the machine is up to a year for certain aspects of it, up to 5 years for the removable pieces such as the sled and pieces that could break after overuse, but the frame in general, like this, has a lifetime warranty. Progress in training method is as follows. Place 17.5 pounds or more on the impulse sled. Demonstrate the exercise. Place the user in the appropriate starting position. Instruct the user to watch your eyes or some object behind you. Caution the user to not watch the sled or the line handle during the exercise. Place the line handle in the user's hand. Grasp the hand of the user and instruct complete relaxation of the limb. Do not progress until you have gained the confidence of the user and your assessment of the limb's motor activity is that of complete relaxation. You must be in complete control, like the lead in a dancing couple. Begin the exercise with what you consider an easy, comfortable intensity, being aware that all motor activity is performed by you. If, through sensory feedback between hands, motor activity is performed by the user, caution the user to relax and let you do the motor activities. Be sure the user is not watching the sled or the line handle during motion. After about 10 relaxed and instructor-controlled repetitions, ask the user to initiate input into the exercise by tracking your motions with the hands. If the user seems uncoordinated, continue exercising by overpowering the uncoordinated condition. Ask the user to relax while exercising and just track your motions. Tracking should occur in about 10 reps. When accompanied tracking is easy, ask the user to control the exercises. Make motion corrections through instructor motion tracking when required. When sensory feedback indicates user control of the exercise, remove your hand while asking the user to continue the exercise. Place close attention to the exercise motion being performed. Look for improper range of motion, improper positioning and range of motion, abnormal muscle tension, retarded muscle return motion, user observance of the sled or line handle. Make the appropriate verbal corrections. Improper motion technique. If the user's coordination begins to fall apart, grasp the hand and begin tracking assistance. When proper motor control returns, release your hand. Ask the user to perform 30 repetitions without assistance.
This is internal rotation of the shoulder using the baseball hand attachment. It's a very good exercise for baseball players who might be throwing a baseball.
Here is an exercise you can do with a patient that is a cervical exercise involving your traps. You should just kind of keep going there. And then another exercise you can do and go into is your rhomboids. And so have the patient stand like so, and they can go through the motions for rhomboids.
So we're going through a series of core exercises that you can do with the impulse machine. This first exercise is rotating your core, really hitting your external obliques. The next exercise we're going to do is with a medicine ball. You will sit on the medicine ball and do a similar rotation. As you can see, this takes a lot of coordination and thinking to get going. Go down. The next exercise will also be hitting the core muscles. She'll move the pulley all the way to the bottom. And we'll go above her head. Again, hitting the abdominal muscles.
The first exercise we'll be demonstrating will be hip abduction and hip adduction. A different attachment is used for this exercise. The strap goes around the ankle of the patient. And the rope is lowered down. And there you see the motion. This is working hip abduction. Adduction. If the patient turns the other way, they can work hip abduction. As you can see, it's a challenge. One of the difficulties of this machine is that you might run into a learning curve, which you're seeing now. But once they get it, they're good. The next motion we're going to show is knee extension. You might have to stand farther away for this one. There we go. Each patient will be different in finding their rhythm based on their height. The final exercise we're going to show is ankle dorsiflexion. As you can see, this is also working balance. With this other attachment, you're able to do radial and ulnar deviation on the impulse machine.